All right, hello everyone. My name is Dr. Joel Rosen. I am the Adrenal Fatigue Recovery Ninja, and today I wanted to answer a question that a new member of our group had posed. I answer it when A, I have a chance to have a break in between appointments, which I do have about a 15-minute break, and B, it seems to be a common question that I feel other people would get a lot of benefit from. So I'm not really singling anyone out or playing favorites. It's just timing and luck. So the way it worked was Suzanne Taylor asked, okay, I'm 50 years old. So I wrote down the notes. Let's take a look at the notes. I'm 50, go even higher. I'm 50 years old and pretty sure I have Sjogren's syndrome and have had it for some time. Currently being tested for this, and I'm 80% of the symptoms. So the first thing I would say with that is that you're autoimmune until proven otherwise. Autoimmune. I wrote that in red because if your immune system is the problem, then that's going to be what we're going to need to focus on. Because when I read the rest of your post, it doesn't mention anything about your immune system thereafter. So I have been chronically low on hormones for 9 years. Chronically low on hormone for 9 years, and more so adrenally challenged my whole life, meaning I've had stress my whole life. So I've been chronically low on hormones and I've been, stressed my whole life. So the way I look at that is chronically low on hormones, I'd want to know what's going on with fat. Meaning, are you getting enough fat? Are you absorbing your fat? What's your philosophy on fat? Are you scared of fat? Do you think it's going to make you fat? That's the thing. What's your cholesterol levels at? How's your gallbladder? Is there any methylation issues? Are you able to make phosphatidylcholine to help make more bile? Are you absorbing your healthy vitamins in fat-soluble, vitamin A, vitamin D, vitamin E, vitamin K? We're not talking about hormones yet, Suzanne. We're talking about immune system and absorption of healthy fats. The next thing we read is, I really cannot seem to make androgens, and more recently since early meno estrogen. So I think I put that there. Can't make androgen, estrogens, and estrogen. So the bottom line is, if you're not absorbing fats and you have a philosophy of, I don't want to get fat, so I keep my fat very low in my diet, and there's some immune-based problems, and there's some vitamin, fat-soluble vitamin depletions, and you are stressed, and you're not making your hormones, it's because you don't have the raw materials. Cholesterol and healthy fats are the necessities to be able to make these things. And so I would really, really question and want to look at your diet and get a good philosophy on how you're eating and what you're using to absorb your healthy fats before you go on hormones. Then we have here, I found an estrogen cream and I could take and have been doing so for a year, but I couldn't take anything else for a long time. Well, I just got on DHEA, a low dose, 10 milligrams for a few weeks ago with great results. So I put in there DHEA 10 milligrams, and that is low. That's not a lot of, that's a small amount, so I'm not too concerned about it. However, what I would say is I would want to know going into it, what were your levels beforehand? That way I would know for how long we would basically be able to go on this. And I'd also want to know what's going on with some enzymes. Are you making more androgens so that when you do get DHEA, is it going to be problematic? Is it going to cause irritability and anger and facial hair and loss of male pattern baldness, even cause cystic sort of developments as well? Then we put in here, I'm sorry, I'm just trying to read what you wrote so that I can answer your question as well as possible. So when you went on that for a few weeks, you got great results. The inflammation and pain went down, and the energy and stamina went up, and your digestion got better. Well, that's good. I mean, again, I think what happened was you got something that you were lacking, and it gave you support, but it's not necessarily filling up hole in the bucket just because you're putting more water in it. If there's a hole in the bucket, eventually that water will run dry as well. Well, nearly 3 weeks on 10 to 20 milligrams, and I am now suddenly very sleepy and depressed from it. It didn't do great things for my dryness in my hair, skin, nails, mouth. Again, I would say probably fat-soluble vitamin depletions. But now I'm a bit oily. Again, maybe we got some androgenicity happening and you're not going upstream to fix the problem. I did do great things. So I backed off a few days, but now my fatigue and pain are returning. Any thoughts? I tried for years to take, and I couldn't do going into a zombie-like depressed state, and I was so hopeful that maybe I could make the hormones I desperately need. Really bummed out. I'm sorry to hear that, but I would tell you, you forgot the main important thing that you talked about, which is 80% of your immune system is in your gastrointestinal tract. And so what I would be looking at, I'd be saying, okay, here's inflammation. And inflammation will feed forward on itself. And it's just causing this, vicious cycle of inflammation. And what that's really doing is it's using up all your oxygen. And as a result, once that happens, if you're using up all your oxygen, you're going to deplete your glutathione stores. And who knows what else is going on from the genetic component. On top of that, we know that you may not be getting your healthy fats. And healthy fats are necessary for your immune system, and it's going to be necessary for hormone production. It's also going to be necessary for nerve function, and it's also going to be necessary for cell membranes. So it's pretty stinking important, and I would be wanting to know how much you're getting of that, because we haven't really talked about that. You're talking about getting hormones, and like most of the people, we're looking for a magic pill to fix a problem, and we need to go upstream to that. So I would also be looking at your glutathione. That's very, very important. Glutathione could be very important for you. Once the glutathione happens to be down, then you have a barrier system problem. When I say barrier system problem, I'm talking about your GI barrier, your brain barrier, and we also talk about your lung barrier. So I'd be asking you, tell me about your immune system. Do you have gut issues, which you mentioned you do? Do you have brain fog, focus, concentration, motivation, which I'm guessing you do? You're bummed out. And then are we coughing? Are we wheezing? Are we shortness of breath? Which perhaps you are, maybe not. So those are the things that I'd be thinking about. When that happens and that goes on for too long, then what happens is you have an imbalance between your immune systems, Th1 versus Th2. You could have too much of a Th2 imbalance or too much of a Th1 imbalance, and that's going to result in an autoimmunity, which you talked about way up here. So how is taking hormones going to fix all of that? It's not. And you found out the hard way. So what I would say to you is reduce inflammation. Look at your immune system. What's triggering it? Is there major infections? Do you have a H. pylori infection? Do you have a bacteria overgrowth? Do you have candida and yeast? Do you have a virus? Do you have heavy metal toxicities? Because hormones aren't going to fix all that. And I've done lots of videos on that. I would also want to know what's the genetic predisposition. Maybe you're not good at recycling glutathione, or maybe you're not good at repairing your DNA, or maybe you're not good at making and breaking neurotransmitters and hormones. So that's going to be really important too, Suzanne. What else would I want to know? I'd want to know about what's going on with the diet. How much glucose, carbs are you eating? How much protein and healthy fats are you eating? I'd want to know all that stuff too. So there's lots of information on here. I hope it's helpful for you. I will tag your name underneath this video and make sure that you get as much benefit, and I hope that's helpful for you. Have a great day, and we'll talk to you later.